My name is Hildegard Theobald. I'm professor for Organisational Gerontology at the University of Vechta. So in fact, we are a very small university, but we are very big in gerontology. So we are the biggest unit for gerontology in whole Germany. And my part here as professor is to have research on social care developments and also very much international comparative stuff.
Okay, and could you break that down a bit? So what are the types of data sets that you're using and what kind of methods that you're using?
As I'm using quantitative methods, now I have a very big survey with care workers in whole Germany, a representative study almost. But I have also done qualitative research and I have also done policy research. So I have done different types of research quantitatively, but the main, what's common for all is that it's very much international comparative stuff. So because I think it's a good way to show how it can work differently. You can get new ideas, what you can do in your country, but also you can see which consequences have different types of policies. It's much easier to see it if you compare it between different countries.
Okay, so what kind of regions are you referring to in terms of international?
Yes, I always do a lot about Europe, and I've started a lot with Sweden because also my dissertation was a Sweden-German comparison. But I have now also done research on Japan and Korea and Germany, and I have also now a project of residential care with Canadian researchers. So it's now become more internationally, actually, even more outside Europe.
Okay, and how would you describe the long-term care system in Germany in terms of the services that it provides from, the public funding, and also, I guess there's a private element as well?
Yes, I think the most important point we discuss services that in Germany we provide a lot of cash payments because we are a very family-oriented system still, and families are supported often via cash payments. That's the first point. And then we have services at home-based services, but also semi-residential care services. We have also residential care services, I think, as in most countries. But what is specific for Germany, I would say, is that our professional care services are very oriented towards personal care, mainly bodily care, and we neglect household services, and social activities are very neglected in Germany's case. But we have also a lot of home nursing because we have a very strong healthcare system actually. It's paying a lot of, so that's a very strong element in the German system. What we have difficulties is, what I tell you now, it's about comprehensive care. This means we have more other types of care services, as household, social activities, and so on. We have a very specific way of doing it. We have introduced in 2002 low threshold services. And these are services which are developed or provided in interplay or in cooperation between professional staff and volunteers. It's a very specific way.
Sorry, low threshold.
Low thresholds, that means that are not expensive, but very cheap services.
Yeah.
We have also specific benefit in our system to approach these types of services, and it's very specific because it's always this cooperation between professionals and between volunteers to provide this mainly social activities actually. I think it's had a lot of difficulties, but we can discuss it later on when we discuss about future prospects and so on.
Yeah.
But it's mainly the German system.
So you said sometimes the household services are neglected. Can you explain more about that?
Yes, as in Germany we have benefits we have different types of benefits, and one type of benefit is related to services. And you have only a certain amount of money available. Of course, you could buy household-related services. It's within this package. It's no problem. But the public support is on so low level that people typically have no money left. Yeah? So they typically buy personal care or bodily care, and then they have no money left. And they said people don't invest a lot of private money in this area. So therefore, it's not forbidden and it's available, but still it's not financed, not publicly financed.
So in the UK, long-term care is typically organised by local authorities in partnership with healthcare authorities. How is it organised in Germany?
It's very different to the UK system because we have two insurances in this area. We have a long-term care insurance, it's social insurance,
okay.
And we have a healthcare insurance, it's also an insurance. And typically on the regional level, the care providers negotiate contracts. You have to negotiate contracts. We have a care market. They have to negotiate contracts with the regional long-term care insurance funds, and they have to define care offers and the prices and quality measures and so on. It's within this contract. The local level are not really involved in Germany. It's very organized on the very much stipulated or by law on the national level. We have very, very strict regulations throughout the countries. Then we have the regional level, which is important with regard, and the local levels are very much outside.
Okay.
But now we try to change it because it does not. It has difficulties if you don't have a local level, because you have to provide the services on the local level, and it's very difficult to have a good development on local levels if you would like to coordinate all from higher levels. Yeah? That's very difficult. So the new idea now in Germany actually is to develop more local levels.
When you say the regional authorities, you mean the regional governments?
I mean, one sense, the federal states in Germany. So, yeah, federal states. We have the federalist countries, and we have federal states, or the Bundesländer in Germany. And the other are within these insurance funds, because it's paid via insurance. So it's not the state is paying, the insurance is paying, and they are also organized on different levels, and the regional level is responsible for the negotiations.
So the private financial companies have some influence as well?
Yes, in financing, yes. In some sense, yes. Because we have, in some sense, two parts. Most people, about 90%, are insured via social insurances, and about 10% are insured via private insurances. And that are mainly the civil forces people, and people with higher incomes mainly.
Okay, and in the future, what do you think needs to be addressed? Can you think of the three big issues in your country that needs to be addressed in this sector?
Yeah, I think one big issue we discussed already a bit is the problem of having more comprehensive care in Germany, because it's only some parts, this is personal care or home nursing, and in Germany also the world changes. We have an increase in female employment, the families are no longer available, then we have big difficulties to provide people with all the care they need. And within this framework, we have now a lot of migrant care workers who are working mainly irregular within the family context. It's there, but not so strong as Italy, because we have professional.
So the migrant care workers.
We have also in Germany. We have actually two developments. We have developed professional care services, but because they are not comprehensive enough, they only provide some parts. We have also within the family context 24 hours care. I don't know if you know this term. That means migrant care workers are living as live-in care workers within the families and providing more comprehensive care. But still it's not the majority. Still the professional care is the majority, but this shows that we have a care gap, and we have a problem with our comprehensiveness. And then we try to change something in the German system, and we try to change it via the local levels, so to really promote the local levels, to involve much more local levels, and we try to use more voluntary workers, which I personally think it's very difficult because our system try to find a lot of voluntary workers, and they typically will not find so many voluntary workers.
You mean they're not paid?
Yes, this may lead at the end that you have a lot of precarious work situations. That they get some type of financing, but not real financing. So if you have, as the German government now tries to develop voluntary work, I think it's too much voluntary work. It's understandable.
Interesting. Okay. So you want to make the workforce more professional, or you think that's a good idea?
As at the moment, our workforce is more professional. As a care workers are the next big issue in the German case. How can we attract or find enough care workers, professional care workers, and how can we finance it? That's the part. At the moment, we have professional care workers actually, but our government wants really to strengthen now this voluntary work.
Yeah.
And I think it's long run it can be deprofessionalization of our care workforce.
And you're concerned about that?
Yes, I'm concerned about that because if you read the government papers or the publications in this area, they're very enthusiastic about voluntary work, what people could do on everything and local level. It's a very enthusiastic situation actually, and my idea is that we will not get so many voluntary workers really doing care work, and then we've learned it from other parts, then it may end that you need voluntary work and then you pay them something, people something to do this work, and that's not really a voluntary work any longer, so then it gets to be precarious work actually.
So you're worried that might lead to a reduction in quality of the care service?
Yes, introduction in quality of care service, but also reduction of professionalism and the working conditions of care workers and so on. Also from their perspective, it may lead to difficulties.
So are the trade unions, do they have any comments about that?
Yes, of course they don't like. They don't like it that you now develop a system with more precarious work. As a risk to become more precarious. It's not there. Yeah? We're really at the beginning to have these all ideas. So it's not already there, but you have this risk, and of course the trade unions are concerned about this development.
Yeah. Okay. And what has changed, if you think about the last 5 years, have there been many developments in long-term care that has changed this kind of issues or priorities?
Yes, we have had very big reforms. We have had 2015, 16 and 17 now. We have three steps of a new law. It's the Pflegestärkungsgesetz. That means a law to strengthen care. It's a very interesting law because it supports now much better people suffering by dementia illness. We will get now a new assessment system where they're much better assessed, much more fair assessed. We have all these ideas about voluntary work and local levels within, which I think it's more difficult on the long run. But we have a lot of ideas how to develop further this infrastructure at home, also to help people to have more comprehensive care who stay at home. That's very, very important point. Another point are the care workers discussion in Germany. It's very important because we don't know how to attract and retain care workers, and we discussed to introduce a new occupational program. In Germany we mainly focus on occupational training programs, not so much academic or university training programs. And we have two types. We have nursing, which is more medical oriented, and we have elder carers, which have also 3 years occupational training program, but it's more social oriented. And one idea is to unify both in one training to make it more attractive for young people to have this, but I think we will have difficulties to introduce it. That's also one point. And we have started to recruit internationally care workers since 2010. A lot of ideas to find enough care workers. So this also area we are very active.
Yeah. The new law. Sorry, what was the name of it?
The law. Pflegestärkungsgesetz, as a law to strengthen long-term care, actually.
Oh, okay. So what are the legal requirements that are going to change practices? So you mentioned dementia assessments.
Yes.
And anything else?
Yes, we have now a new assessment. Our former assessment was very much oriented towards functional difficulties, and we started in 2002 to have a second part, to have more these ideas of people having difficulties to manage their daily life, not so much functionally, like dementia, people suffering by dementia illness. And we have 2 streams all the time, and now we introduce a new assessment which combines both. And now we are looking if people are able to live autonomously and can manage their daily life. As it's much broader, and it's a bigger support for people suffering by dementia illness. That's good. I think it's a very good point of this law also. But it's assessment. It does not mean that you automatically get more services. You're only fairer assessed. Yeah?